Inflammation is a response of the immune system when there is infection or acute injury to the body. In this case, inflammation is serving an important purpose by keeping the body healthy and restoring homeostasis. However, in cases where the immune system malfunctions, inflammation can work against our health and make us sick and damage our body's cells. What is the difference between a healthy immune response and an unhealthy one? Are there ways to rebalance the immune system when it does malfunction? Well, I'm about to tell you, so stay tuned and find out. I am Dr. Victoria Munoz, and I specialize in regenerative medicine. Regenerative medicine is a specialty area of medicine that serves to heal and repair the body and reverse aging by providing the tools to stimulate the body's intrinsic ability to heal. My goal as a doctor is to educate, heal, and reach the masses with the message of regenerative medicine. So what is inflammation? Inflammation is the body's way of protecting itself from harm in an attempt to repair damaged tissue or remove pathogens. In the case of traumatic injury, there are a series of reactions that take place in the body in order to restore homeostasis. First, there is a compromise in the tissue integrity and erythema or redness appears. This is due to the fact that blood vessels surrounding the injury become more permeable, allowing fluids and protein to move into the interstitial space, which is the space between the damaged cells. Neutrophils, a type of white blood cell, will appear first, followed by macrophages to do the cleanup work. The neutrophils are attracted to the injury through a process called chemotaxis. The injured cells send out an SOS signal, recruiting the immune system to the area. The redness and warmth over the skin of the injured area is evidence that inflammation is present, which in this case is a good thing. The immune system responds similarly when there is a pathogen invading the body. There are 4 stages to the immune response, so let's look at them briefly. The first phase is homeostasis. This begins at the onset of injury. The goal of this step is to control bleeding and initiate clotting. The second phase is inflammation. The neutrophils are recruited through a process called chemotaxis, and repair of the damaged tissue begins, as well as removal of debris or pathogens. This phase usually occurs over a 72-hour period. Then the macrophages come in and finish the work. Phase 3 is proliferation. The goal of this phase is to fill the wound with new cells. There are 3 stages: filling in the wound, contraction of the wound's edges, and covering the wound, which is called epithelialization. This phase usually takes from 4 to 24 days. And then the 4th phase is maturation. The newly laid tissue gradually gains strength and flexibility. Collagen fibers reorganize and gain strength. And this new tissue is typically known as a scar and has about 80% the tensile strength of the original uninjured tissue. This phase can last anywhere from 21 days to 2 years. So now let's look at acute versus chronic inflammation. Inflammation is the body's defense mechanism, which serves as a protective mechanism. Acute inflammation happens over a matter of hours to days. Chronic inflammation, on the other hand, can linger over months or even years. Acute inflammation serves an important purpose in keeping the body healthy. Chronic inflammation is a more serious condition that poses many health problems. Chronic inflammation is a silent killer and is responsible for 7 of the top 10 causes of death in the United States. Contributing factors to chronic inflammation are poor diet, lack of exercise, stress, poor lifestyle choices such as smoking, and exposure to environmental toxins. Symptoms might include brain fog, digestive problems, joint pain, fatigue, headaches, and weight gain, just to name a few. Obesity and hormone imbalance are also major contributors to chronic inflammation. So let's look at each of these a little more closely. Sugar, defined as cane sugar or high fructose corn syrup, are commonly added to processed foods. When we consume sugar, it travels through the GI tract and into the bloodstream. Once sugar is in the bloodstream, cytokines are released, which are immune cells involved in inflammation. Consuming just 50 grams of refined sugar greatly increases inflammatory markers in the blood, including C-reactive protein, which is CRP. Sugar consumption also increases the production of advanced glycation end products, or AGEs. Too many AGEs lead to oxidative stress, which leads to inflammation. Other concerns of sugar consumption are inflammation of the gut leading to leaky gut, heart disease, stroke, diabetes mellitus, and cancers. Stress in the form of panic, irritability, and anxiety will cause excess amounts of cortisol to be released from the adrenal glands. As cortisol and adrenaline are released, the body prepares for quick action. However, when this takes place long term, our body becomes inflamed, making us susceptible to chronic disease. And then there's diet, the consumption of processed and fast foods. Not only are these foods devoid of nutrients, but the preservatives leave our bodies toxic. Though companies will fortify vitamins back into processed foods, this does not make these foods healthy. This is only done to mitigate severe disease. And then there's food allergies. An allergy is the immune system's response to a substance which will ultimately cause inflammation and cellular damage. Allergens can irritate the GI and respiratory tract, as well as cause generalized symptoms such as generalized fatigue, joint pain, and headaches. Foods that are commonly considered healthy will cause severe symptoms and health problems in sensitive individuals. In the case of leaky gut, whole food particles will pass through the gaps in the tight junctions of the gut lining. The individual will react to everything as if allergic. By healing the gut first, any remaining sensitivities can be more easily addressed. Obesity. This can cause inflammation in a couple different ways. Diabetes mellitus type 2 causing elevated blood sugar levels, as well as fat cells releasing chemicals causing the increase in cytokines in the body. Remember, both sugar and cytokines cause inflammation in the body. Hormone imbalance. Deficiency in hormones such as testosterone and thyroid hormone can cause increased inflammation. These deficiencies will lead to increased cytokine production in the body, as well as metabolic deficiencies. This is in turn responsible for symptoms related to these deficiencies such as brain fog, weight gain, decreased muscle mass, joint pain, fatigue, and more. And last but not least, environmental toxins. A toxin is defined as an antigenic substance that causes disease at low dose and occur in nature. Examples might be bee or snake venom. An environmental toxin, however, is synthetic in nature and poses more of a concern when we talk about chronic disease. Our environment is laden with synthetic toxins. So how do we know what to avoid? You can research your products or find safe products at ewg.org. So what is the solution to these issues? Find a physician who understands lab values on a comprehensive level and is invested in finding root cause of disease. When contacting a physician's office, ask if they do testing for environmental toxins such as heavy metals, and ask if they do chelation therapy. If your issue is metabolic, ask if the physician works with metabolic issues such as thyroid and hormones, as well as lifestyle changes including diet, exercise, and smoking cessation. If you're seeing a physician for chronic pain issues related to the musculoskeletal system, ask if the physician is certified in regenerative medicine. So tune in for our next episode where we begin talking about surgery, when it's indicated, and why it's overprescribed. If you'd like more details or to get a head start, you can purchase the pain solution. You will find 2 links in the description below. One is to purchase my book on Amazon, and the other is to message us directly through my website to request a signed copy of the book for no additional cost. Please like this video and subscribe to my channel if you haven't already. Hit the notification bell to receive all notifications so that you don't miss out on any more great videos to come. Also, please leave a comment below on how this video has helped you. I am Dr. Victoria Munoz, CEO and owner of Regenerative Sports Medicine and Anti-Aging, where we've been rebuilding bodies since 2017. Until next time, take care.